In a blog post for the Harvard Business Review, Weiss says while there were misrepresentations at the company, a fixation on Enron's stock price caused the collapse. He says the off-balance financing arrangements that were the object of so much scorn could have saved Enron because they allowed the company to compensate investors by issuing more stock.
Ken Lay didn't want to issue shares because that would have greatly diluted the share price.
Fastow himself, in comments on the blog, claims he and Lay had a heated argument over that very issue. Fastow warning that if Lay refused to issue stock, it would kill the company. Lay, meanwhile, blamed Fastow for the collapse, but never fully explained why he decided to unwind the accounting. Lay died after his own trial in 2006, taking one of the great mysteries about Enron to his grave. Scott Cohn, Nightly Business Report, New York.
And that is Nightly Business Report for tonight. And we want to remind you that this is the time of year your public television station seeks your support to make programs like this one possible.
And I'm Tyler Matheson. On behalf of your public TV station, thank you for your support. We'll see you right back here tomorrow night.
Nightly Business Report has been brought to you in part by
TheStreet.com, up-to-the-minute stock market news and in-depth analysis. Our quant rating service provides objective, independent ratings daily on over 4,300 stocks. Learn more at TheStreet.com/NBR.
Programs on MPT are made possible by our members and the following.
Hi, I'm David Scheffnacher. My company has supported MPT for many years, and I'm a big fan too. In these times, it's more important than ever for Maryland companies to join me in supporting MPT. Thank you.
On the next Direct Connection, your chance to talk to the experts. MPT's live interactive discussion program, a part of Public Square, tonight at 7:30.
Public Square on MPT. It's TV worth watching.
Returning to PBS, Frontline's acclaimed history on the origins of Christianity. No matter what your faith or what you believe, this series asks you to reconsider what you think you know. Don't miss this encore presentation. Watch the remarkable story of how Jesus became Christ.
Tuesday night at 8 on MPT.
My parents met because they both worked on the railroad. There was actually no question I was going to go to work on the railroad. I knew that from the very beginning when I was a little kid. My dad taught me to be kind and think about other people. And that is what I'm trying to instill in my family. My granddaughter is named June Elizabeth, but I call her Junebug. My hope is to teach her about kindness and about the love of animals and nature. I want Junebug to have the same opportunities I had by watching PBS. It has helped me understand so many things in our world. My husband and I feel so strongly about our PBS station that we've included them in our estate plan. PBS is part of our values, things that we cherish, and we want to pass it on to the next generation.
It's one of public television's most loved comedy dramas.
To have it go global is beyond our wildest dreams. It's extraordinary.
Travel to Port Isaac in Cornwall for the making of Doc Martin.
Filming gathers crowd, and that's part of the fun of it.
The cast and crew talk about creating the hit series.
Martin's least like his character,
which makes him the best actor on it.
Go behind the scenes in Doc Martin Revealed.
Thursday night at 9 on MPT.
MPT has partnered with Zifter to bring you the totally free online shopping tool that gets you the absolute lowest price on pretty much everything, everywhere, every time. Here's how it works. You shop wherever you want. Zifter searches the web and compares prices in the background to save you money. And a portion of the savings goes to support MPT. Just go to mpt.org/Zifter and shop, save, and support. MPT.
Well, as usual, in the upcoming season, we have lots of new characters coming in.
They're all really handsome.
The first person who comes in is Lord Gillingham, who's played by Tom Cullen, and he used to visit them when they were children with his parents.
He's never managed to settle down. Then he comes across Mary and he admires her very much. She likes him, there's no question about that. They all like him.
And actually, he's someone whose heart rules his head.
And Nigel Harman comes as a new valet at the house.
Carson sees him as rather disruptive. You know, there's a great house party at one point, and Green is getting them all to play Racing Demon down in the servants' hall, which of course is absolutely opposite what should be happening.
Another wonderful English actor called Julian Ovenden arrives to play a character called Blake.
My character, Charles Blake, works for the government and immediately gets off on the wrong foot with Lady Mary. He has a bit of a chip on his shoulder about people with privilege.
And of course we've also announced Gary Carr, who's joining the show. There's been some interest in the first black character to come into the show, so he will join as somebody that we meet in a sequence in London.
We've got a new lady's maid for Lady Cora.
She's got the job sort of through Thomas's machinations, and there's a secret there of hers that Thomas is keeping, but we don't know what it is, but he's obviously got some kind of a hold over her.
And we have Dame Nellie Melba, who was the great opera star of that period. And we were very, very lucky because Dame Kirita Kanua agreed to play Nellie Melba. Actually, it was a rather marvellous day on the set, because there we were, sitting, listening to Kirita Kanua for nothing, you know, quite a big treat.
Direct Connection is made by MPT to serve all of our diverse communities and is made possible by the generous support of our members. Thank you. Live from Maryland Public Television, this is Direct Connection with Jeff Salkin.
Hi, everybody. Thanks for tuning in for Direct Connection. Coming up tonight, a new hospital payment system for Maryland. We'll find out what that means for patients. That's coming up. First tonight, as American Catholics begin observing the period of Advent leading up to Christmas Day, they are doing so this year with a new pope. Joining us to talk about the remarkable reign so far of Pope Francis is Frederick Bauerschmidt, the chair of the Department of Theology at Loyola University of Maryland. Professor, thank you for being with us.
Well, thanks for having me.
This pope has fascinated a lot of people, upset a few, and inspired many. What's most interesting to you?
Well, I think one of the things that is probably underestimated in its significance is he's, in a sense, a New World Pope. He's from the Western Hemisphere. And I think as different as the cultures of North and South America are, there is some kind of freshness to the New World, and that he's bringing some of that into the world of the Vatican.
So it's an outside the Vatican perspective, and was that perhaps part of what made him appealing to the cardinal electors at a time when so many people are looking for reforms of the bureaucracy?
Well, I certainly think, if you think about Pope John Paul II, he had a very long reign. He reigned for some 25 years. And then when Joseph Ratzinger was elected Benedict XVI, he had been in Rome for most of the reign of John Paul II. So he was really part of that world of the Vatican. And so it wouldn't surprise me, of course I have no insider knowledge, but it wouldn't surprise me if the cardinals thought, let's bring in a fresh perspective. Somebody, not a bishop who's been working in the Vatican for decades, but somebody who's been out in a diocese as the pastor of a local church, and bringing that perspective into the Vatican.
What would you say has been Pope Francis's impact so far? I mean, we hear about more people in the pews, new excitement, and a different sense of mission.
Well, I think in talking about mission, you're really hitting the nail on the head. As this past week, the Pope issued what's called an apostolic exhortation. It's actually a rather lengthy document. I spent my Thanksgiving holiday perusing it. And the focus there is very much on mission. I think Pope Benedict was very concerned about the internal life of the church. And reasserting a sense of the identity of Catholics, a sense of tradition, and that's all well and good, but Pope Francis has chosen a somewhat different path. He wants a church that is, in a sense, outward-looking. He, in this apostolic exhortation, he said rather strikingly that he would prefer a church that is bruised and dirty because it's been out on the streets, rather than a church that's been turned in on itself.
What is he trying to accomplish with that? I mean, it's certainly a long-standing institution that's probably hard to turn on a dime.
That's certainly true, but we've also seen during the 20th century rather dramatic developments in the church, with the Second Vatican Council, but also with other developments in the church. It can't turn on a dime, but of course, as a theologian, I believe that there's the Holy Spirit within the church bringing new life constantly. So I think really what Francis is trying to do is he's trying to assert the core identity of the church, which is a church which is bringing good news to the world, and that has to have priority over the church's own institutional life. That what is most important is the institution has to serve the mission. The mission doesn't serve the institution.
And he's made that point, and I guess the question is whether it's a change of emphasis as opposed to a change of doctrine. People have been, in some quarters, looking for change when it comes to abortion, ordination of women, contraception, and there hasn't been a change, but a lot of that has been de-emphasized, maybe.
Yeah, in the recent apostolic exhortation, you can find a very strongly worded paragraph on abortion. You can find a reassertion of the Church's traditional teaching on reserving ordination to men. But I do think that there's certainly a change of tone. I also think if you go back and read through the writings of Pope Benedict, you can find many of the things that Pope Francis is saying in the writings of Pope Benedict. But again, I think there is a slight change of emphasis, less inward-looking, more outward-looking, emphasizing the challenge and joy of Christian faith.
Let me remind our viewers, if you have a question about Pope Francis, the future of the Catholic Church, please give us a phone call. We'll have the number up on the screen. You can also tweet a question. Our Twitter handle is @MPTNews. That's @MPTNews. Do you think these first 9 months or so of the papacy of Pope Francis have surprised the cardinal electors in any way? Did they know fully what they were getting?
I suspect they had some idea of what they were getting, though Francis does seem to have this capacity for spontaneity that we don't usually associate with cardinals. I think while they had some idea of what they were getting, and they wanted somebody who could really communicate the core message of the church, a message about God, about Jesus, about caring for the poor, they probably did not expect that he would go about things in exactly the way that he has.
Talk a little about the symbolism. He doesn't wear a gold cross. He wears an iron cross. Maybe it's silver. Doesn't live in the papal apartment. He lives at some sort of hotel in Vatican City, drives an old car, carries his own bag. Is there substance behind that style?
Oh, I think the if you will, stylistic change grows very much out of who Francis is as a person. I think the choice of the name Francis showed from the outset, I mean, this was not a name that any pope had ever chosen before.
It wasn't Francis the 16th.
No, no, it's Francis, well, the next Francis will be Francis II. Yeah. But I think the spirit of St. Francis, the spirit of simplicity and poverty, I mean, this has always been one of the church's most powerful tools for spreading its message. I mean, I remember when Pope Francis was elected, having a discussion actually with a couple of bishops, and one of them made the point that two of the church's most powerful tools are poverty and martyrdom. that these are things that really speak to something deep in people's hearts, that this really shows that the church means what it says. And I think the decision not to live in the Apostolic Palace, to live in the Casa Marta, which is a kind of a hostel, the fact that he eats dinner with people, other guests staying there, that he celebrates Mass publicly in the chapel there every day. This all is not mere style, it really is who he is. He's someone who wants to connect with people because he feels that the message that he has to bring, the good news he has to bring, is something that people desperately need in their lives.
So you're a theologian, not a politician. But a lot of the theology will be over the heads of me at least, and maybe some others. Where is it heading? What's the likely trajectory of the papacy? I mean, do you see this leading, and you read the apostolic exhortation. Where does that lead?
Well, I think Francis really does want a church that's very outward looking. And I think for successors to Francis, whoever the next pope is, Francis II or Benedict XVII, I think there are certain moves that Francis has made that will be hard to undo. And I think it's partly because his way of being pope has proved to be so appealing to such a wide spectrum of people. I think he's really teaching the church by his example, perhaps at least one new way of being pope in the 21st century.
Let's take a phone call. Janet in Montgomery County. Janet, thank you for calling. Go ahead.
Yes, I'd like to ask your guest, actually as a Lutheran married to a Catholic, we both find this new pope quite refreshing, and it's kind of exciting to hear someone who's actually more worried about the people in the world rather than Rome itself and the Vatican. And I'm just wondering, in his new exhortation with talking about income disparity, is there really a way that you think that the church can help to bring the income and earnings gap closer? Because I do think that's going to be critical down the road, especially in countries where he is really so popular, in the country he came from even.
Janet, thank you for the phone call. Did you read the document to be anti-capitalism, as some did?
No, I don't think so. Of course, the Catholic Church traditionally has had less enthusiasm for capitalism than we typically have here in America. But the church has always affirmed, the value of free markets. I think what Pope Francis is trying to say, though, is that the freedom of markets always have to be in service to the basic needs of human beings. And if free markets are not meeting those basic needs, it is morally incumbent upon states to intervene in those markets to make sure that people's basic needs get met. And I think he is a little dubious that basic needs do get met. But I think the Pope is not going to make specific policy recommendations. He knows that's not his role. I think what he's going to do, and what he's trying to do, is for those who are in a position to make specific policy recommendations, who claim to be Christians or just decent human beings, he's going to really hold their feet to the fire. And he's going to say, well, you claim to have these moral values. Let's see how let's see how this plays out in terms of care for the poor, care for people who are oppressed and marginalized. Let's put some action behind these beliefs.
Before we go, what do you make of this survey that has been distributed in parishes around the state that comes from the Vatican, from the Pope?
Well, I'm going to be very interested to see what the responses are like. I filled out the survey myself, and I'm a professor of theology, and there were a couple of the questions that even I didn't understand. So, in fact, that's what I wrote as my answer. I don't understand this question, but I think just the very act of asking the average Catholic in the pew, what do you think about these issues? And the questions are all about marriage and family. And so just the very act of asking married people who have families what they think about marriage and family and the church is, I think, a great step forward.
Very good. Professor Fritz Bauerschmidt, Loyola University, Maryland. Sir, thank you for being with us.
Thank you.
We appreciate it. Just ahead tonight, what does Maryland's new Medicare waiver mean? We're back with more of your calls in just a moment.
What I like about Twitter is its simplicity. You type your message on a screen and click share it with the world.
But all those words can get kind of boring after a while.
What do you want? Lights, cameras, action?
As a matter of fact, yes, which is why I've taken a liking to Visify.
What Visify does is create a video biography for you, complete with sharp graphics, photos, and cool music.
And it does this by looking at your last 3,000 tweets.
A few days worth, in other words.
Yeah, for you, maybe. And it tells people what you tweet about and what time of day you post most of your messages and who are your most popular followers.
And it adds a few sample tweets.
Now, some people have raised privacy concerns.
Visify, which is partnering with Twitter, asks for your home address and home phone numbers.
But the company says it isn't storing that information right now.
The best part is that the videos are created automatically, though you can tweak it a little bit at the end.
Which, of course, leaves time for more tweeting. And that's your daily download.
Do you know me? Of course we know you. Who could ever forget Pavarotti? And how his singing thrilled us for 50 years. Now some of his greatest performances thrill anew in a program that celebrates his amazing voice. Delight in Pavarotti, a voice for the ages, only on Great Performances.
Tonight at 8 on MPT.
And with us now in the studio is Carmela Coyle, the president and CEO of the Maryland Hospital Association. Thank you so much for being here.
My pleasure.
The state is at work on a new hospital payment system. Explain what they're up to, and then we can talk about what it means for everybody.
Sure, and it's probably easiest to start with a little bit of history. That is, 40 years ago, Maryland applied to the federal government for an opportunity to pay hospitals in a way that was very unique, very different, and different than the way that the Medicare program pays hospitals in the other 49 states. That system involves the fact that there is an independent rate-setting commission in the state of Maryland that actually sets how much hospitals get to charge for the services that they provide here in the state.
Does that mean that Hospital A charges the same thing as Hospital B?
There are differences between hospitals, but within a particular hospital, it doesn't matter if you have Blue Cross coverage, or Aetna coverage, or Medicare or Medicaid, or you're paying on your own. Within a particular hospital, the prices that hospital charges are the same for all patients.
Let's spend a minute on this, because the system, which was set by the Maryland Health Services Cost Review Commission, got good press. I don't know where the truth was, but it was seen as something that kept hospital rates under control when they were racing ahead in other places. Yet, I don't know that any other states adopted a similar system.
That's right. Maryland remains the only state that operates in this fashion. When these were put in place about 40 years ago, there were a handful of states that were operating this way, but they've all gone by the wayside. Maryland is the only state remaining where the state takes an active role in setting hospital prices.
So does it need to change now for some reason?
40 years is a long time. It's in need of a bit of a brush up. It's in need of some modernization. In particular, when the system was set up 40 years ago, people were concerned, of course, about the cost of healthcare services. But we focus very narrowly on the cost of an inpatient hospital stay. And today we're doing so much more on an outpatient basis. And it's more than just the cost of a service. It's also about how well we're doing. What's the quality of that service? How safe is the service that we're providing?
So what is likely to emerge from this work that's being done?
We are poised, and we think the federal government is very close to approving an application that was filed by the state of Maryland, and it's really going to do a couple of things. Number one, we hope will work to make healthcare more affordable in the state of Maryland. We're going to do that by setting some very strict spending caps on the annual rate of growth in hospital spending in the state. Never been done before. And second, we think it's going to make healthcare safer. Again, some very strict requirements around issues of patients coming back to the hospital. How do we keep that from happening? And complications while you're in the hospital, things like infections. Very strict metrics and measurements that we will adhere to in order to make certain we're providing the safest care possible.
Let's take a phone call. This is Myra in Howard County. Thank you for calling. Go ahead.
Yes, recently, earlier this year, I had surgery at Johns Hopkins Hospital in Baltimore, Maryland. And I was surprised to find out that Johns Hopkins is a nonprofit, and they filed a Form 990. And I checked online, and I noticed that for the fiscal year ending last year, 2012, they filed their Form 990 this year, and they had a total net profit of $86 million. And I wanted to know, how does that factor into how much they charge? The fact that they're not a corporation, but a nonprofit.
Interesting. Myra, thank you so much for the phone call.
Thank you, and thank you for the question. It's important to understand that not-for-profit means that any funds that are left over after the health care bills are paid for do not go into a shareholder's pocket. That money, while it may be left over after a year or two, is money that is plowed right back into healthcare services and the cost of providing that care.
I'm trying to think of a for-profit hospital in this state.
There is not a for-profit hospital in the state of Maryland. That is not true in the other 49 states, but in Maryland, all of the hospitals are not for-profit.
How are they doing financially? Are they all showing, maybe you can't call it a profit, but a surplus at the end of the year?
Actually, where we find ourselves at the moment is with hospitals at one of the worst financial positions they've been in the 40-year history of this rate-setting system. Today, 40% of Maryland's hospitals are losing money treating patients. It's quite a serious situation. One of our biggest challenges as we move toward this new way of paying for hospitals is we're asking hospitals to transform, to change in very big ways at a time when they are the most financially strapped.
Well, give an example of the change. What would be different maybe in somebody's bill going forward, whether they acquired an infection in the hospital or not?
Sure. The biggest change, I think, is that previously hospitals were paid for every patient who came into our organizations. So every patient who came into the emergency room, every patient who came in to the hospital, admitted to the hospital, we were paid per patient. What we're moving to is a system of more global budgets where what we're really going to do is to reward hospitals to do the right thing. That is, to keep patients healthy and well, and if possible, out of the hospital if they don't need to be there, in a less costly setting, if that's what is medically appropriate, so that the patients left in the hospital were truly treating those who are the most acutely ill.
Say somebody walks into the emergency room with a broken arm and x-rays are ordered. Maybe I should have come up with an illness that required something expensive like an MRI. They still get billed for that?
Hospitals, first of all, our mission, and we will always continue to provide care for anyone who comes into our emergency room doors. But yes, patients are billed by the service, whether it's an emergency room service or a hospital admission.
So you're not talking about going to a flat rate where you walk in the door with this condition and the hospital gets X dollars to get you out the door.
That's correct. What we are doing, though, is to talk about changing the incentives, that if today the incentives are to be paid more if you do more, which may generate unnecessary services being provided, we're trying to change that to say, let's make certain we are rewarding the right things, providing the care that's necessary, but not more than that.
Let's talk to William in Baltimore City. William, thanks for the call. Go ahead.
Yes, you had a comment there that said that the hospitals charge the same amount of money for every service. My point is that, yes, but you allow insurance companies to pay less of this bill than the individual does. The point being is that I spent 3 days in Johns Hopkins, paid $12,500 out of my pocket, and my CPA accountant told me to ask the hospital if I could pay less, and exactly what she said. All hospitals charge the same exact amount, but the insurance companies are allowed to pay less of that amount, and I wish that would change.
William, thank you very much for the phone call. I knew that they could get a discount by paying promptly, but it was a small discount, 1% or 2%. Do the hospitals get more of a break?
And William,
the insurers get more of a break.
Yes, and I'm not familiar with his situation. In some cases, insurers may create networks, and if an individual is seeking care at a hospital or a physician office within that network, there may be a lower rate. The most important thing for the caller or for anyone to know, if you have challenges with your hospital bill, the first call should be directly to the hospital, to their financial assistance programs to get the help that you need.
But if the system was set up so that everybody paid the same thing, it sounds like everybody hasn't been paying the same thing.
They are paying the same amount. The charges are the same for each service within a particular hospital.
George in Anne Arundel County. George, thank you for the call. Go ahead.
Thank you.
Sure.
At the very beginning, the guest mentioned that there is the proposal on the table is to have all the hospitals agree to a cap on inflation that increases to
George,
the charges.
I just have a couple of seconds.
And so I wonder how can they do that when they don't know what inflation is going to be, and the economy is like saying if keep your feet out of the water, but the river is rising.
George, thank you very much.
And George, you've hit the nail on the head. One of the challenges in all of this, many opportunities to provide better care, but one of the challenges is we are being asked to limit the rate of growth of hospital spending in the state. We don't know what future inflation may look like. We don't know what some of those cost increases may look like. But it's important to say this is a collective effort on the part of the state and hospitals
Carmela
to try
Coyle,
to limit that together.
We have to leave it there. Thanks for being with us.
Thank
you for joining us for Direct Connection. Have a good night.
This program was made by MPT to serve all of our diverse communities.
Tonight on MPT.